So hello, everyone, and welcome to Physician Spotlight. I'm your host, Dr. Lindsay Russell, and I just want to touch on that Physician Spotlight is a forum to learn more about our outstanding senior leaders, young rising stars, and international colleagues in the field of nutrition, and really to discuss important topics and ideas. And with the help of Aspen, we're bringing you these videos today. And our guest today is Dr. Maitreyi Raman, and it's my absolute pleasure to introduce her. Dr. Raman is an associate professor of medicine at the Foothills Medical Centre in Calgary, Alberta, in Canada. And she's also the medical director of the Southern Alberta Home, Enteral, and Parenteral Nutrition Program. And she's truly a gifted clinical researcher with an interest in a variety of topics, including nutrition and IBD and liver disease. So I'm so excited to have you here, Dr. Raman, today. I was looking back, I worked with you in fellowship 5 years ago, so it's so nice to see you. Time truly flies by, and really thank you for joining us today.
Thank you very much, Lindsay, for this opportunity and for inviting me to participate. I'm very excited to be here.
Wonderful. So we'll start off with the first question that we generally ask everyone. And we really want to know a little bit more about yourself and your journey in nutrition.
Okay, so I am a gastroenterologist, and I completed my nutrition fellowship a long time ago in the around 2004-ish. And at that point in time, there were very few clinician or nutrition-focused clinicians and or nutrition-focused clinician researchers or clinician scientists within the gastroenterology landscape. And this always puzzled me, particularly as a trainee, given that nutrition seemed so fundamental to most digestive health conditions. So at that point in time, I explored the opportunities for possible fellowships and heard really wonderful things that were going on at the University of Toronto. And I made my first connection with Dr. Joanne Allard, who was very inspirational and influential in terms of my future career path. I went over there to the University of Toronto, did my fellowship in nutrition, very much focused on enteral and parenteral nutrition at the time, but quickly evolved thereafter to multiple other components that I'm engaged in and prioritizing today.
Oh, that's great. And you mentioned something when you were first starting in nutrition. It was kind of a novel thing to have clinician scientists in the field of nutrition. In that regard, you mentioned Dr. Allard as well, but how do you feel about up and coming in the field when there's maybe not a lot of role models, or how do you find mentorship when you're first starting out in a career in nutrition?
Yeah, thank you for that question. Mentorship in a field that is, let's say, underrepresented perhaps, is absolutely critical to really push the bar forward. Without having the opportunity to interact with Dr. Allard and her team, I feel like I would not have had the support or the opportunities or the skills to be able to get to where I am today. And further, gastroenterology being fairly a male-dominated profession, and academic medicine perhaps being the same way until hopefully things are changing. Having identified a female role model in Dr. Allard was like gold to me. I feel like that experience really has been critical to where I am today. So reflecting on that and thinking about that, I value every opportunity I have with my research-focused students, my graduate students, as well as my medical students and residents and clinical trainees. And I really hope to have the same influence on my trainees as Dr. Allard had on me.
Oh, that's wonderful. And I certainly can reflect back to the time when we worked together as a young trainee. I think you certainly inspired me and to incorporate research and clinician and clinical care. On that note, I would love to touch on kind of your current research or what you've been working on now. I've heard a little bit in other meetings in the Canadian platform, but please, if you could kind of highlight what you're currently working on and how that's impact your clinical care.
Yes, absolutely. So for the last 10 years or so, I've shifted a little bit away from enteral and parenteral nutrition being the focus of my research program to evaluating and assessing the role for dietary therapies, dietary components, diet composition, nutrients, and malnutrition in inflammatory bowel disease in particular. So with sort of the explosion of interest in the gut microbiome and understanding how the gut microbiome can have an influential mechanistic role in the pathogenesis of inflammatory bowel disease in terms of disease onset, as well as potentially being used to manage disease, both from symptoms as well as modifying disease course through inflammation, this area of interest really has become a priority for my research program. So we have been lucky to have multiple sources of funding to execute a variety of different trials from a methodological perspective to explore the role of diet and dietary components and composition in the course of IBD. And this really has been a huge team effort, a huge multidisciplinary team effort, I should say, with cutting edge clinician scientists, dietitians, as well as having the infrastructure and support through our university to be able to lead to all of this work.
I think that's truly wonderful. And I know at Aspen, we're really focused on multidisciplinary work, and nutrition is unique in the field that it can be so multidisciplinary. I did want to ask as well, like as a gastroenterologist, I feel like even within the field, there's little, like you have your therapeutic endoscopists, the IBDologists and nutrition. How do you feel about the multidisciplinary work, even within the field of gastroenterology or other physicians that you may work with?
Great question. So even thinking back to my residency and fellowship years, like you mentioned very appropriately, there was a very large emphasis on subspecialty training in therapeutic endoscopy or hepatology or IBD, but really nutrition was never posed or positioned as an option for a subspecialty. So even reflecting on that and how I navigated those times has led me to really prioritize and increase visibility of nutrition as a subspecialty option for gastroenterologists. And I feel like within the University of Calgary, we are very blessed to have so many experts in all of these fields. And here as well, in addition to myself, there are a few other gastroenterologists with expertise in clinical nutrition. Research less so, but within the clinical practice of nutrition, there are several of us who have expertise and training in this field. So I think when I reflect on research, particularly integrating nutrition into a hepatology related study or integrating nutrition as part of an IBD related study, it's really a really privileged position to be in, I think, because nutrition applies so broadly to every condition within gastroenterology. So the opportunity for collaborations across the board are very rich.
I think that's truly wonderful. And I think it's nice to see that visibility and the work towards making nutrition really a foundation in a lot of institutions in Canada. So as we're kind of closing off, my last question is any words of wisdom that you might have for either young career, like such as myself, or any fellows or trainees. I know you mentioned that you worked with quite a lot of trainees. Any words of wisdom or advice that you would give?
Well, I think that nutrition continues to be an underrepresented field within gastroenterology. However, there are a lot of opportunities, I think, in the field as well. So for those aspiring clinicians, scientists within gastroenterology that are looking for nutrition as a career, I think A, there are jobs, and B, there is need. Nutrition and diet still continue to be amongst the most frequently asked questions amongst patients living with inflammatory bowel disease. And I think various organizations and professional platforms really are prioritizing funding for advancing research in nutrition as applicable to inflammatory bowel disease or liver disease or other. So for those that may have interest in nutrition, I think there is tremendous opportunity for career and career advancement. So I would encourage any new aspiring trainee or early career scientist and physician to consider that as they're making their decisions moving forward.
I think that's absolutely wonderful and really good advice. And so with that, Dr. Raman, I really want to thank you for taking the time with speaking with me today. And I really want to thank Aspen for their partnership into continuing with this program, and to our audience to taking time to listen. I hope everyone has a great day, and I hope you took some tidbits from this talk. Thank you so much.
Thank you very much.